What is adjustment disorder? Good question. Hey, I'm Dr. McCleary, and I make mental health videos for veterans. Adjustment disorder is one of those disorders that gets diagnosed a lot. And there's some good reasons for that and some not so good reasons for that. Let's start with the good reasons, and arguably the only reason that somebody should get diagnosed with adjustment disorder. That reason is they meet criteria for adjustment disorder, and there's no other mental health disorders that would better explain the diagnosis. This is really the only good reason. The not so good reasons for a diagnosis of adjustment disorder really fall under the camp of you don't have adjustment disorder, you have something else. The problem sometimes lies in the fact that adjustment disorder is pretty easy as far as mental health disorders are concerned to meet criteria for. And that causes some problems with a lot of different clinicians that are doing the diagnosis. So what ends up happening is someone meets criteria for adjustment disorder, and we'll go over the symptoms in just a moment here. But the therapist, the psychologist, the physician, the nurse, whoever it is, doesn't ask the appropriate additional questions to determine if something else might be going on. So what you find sometimes is people are diagnosed with adjustment disorder, and arguably they meet criteria for it. However, if you were to ask somebody some additional questions, you might find out that adjustment disorder isn't exactly the correct diagnosis. Maybe it's PTSD, maybe it's depression, maybe it's anxiety. But if you don't ask those additional questions, or you don't know the additional questions that you should ask, then adjustment disorder is an easy go-to for a lot of clinicians. Now, I'm not saying that clinicians are just giving out a diagnosis of adjustment disorder, all willy-nilly. At the same time, if you feel like your diagnosis is ever not accurate in some way, and that something else might be going on, I suggest that you talk to that clinician and ask them, why do I have whatever mental health disorder that I have or that you diagnosed me with? That's part of their job too. Not just to diagnose you, but also to explain it to you. If you're getting value out of this content, go ahead and click that like button or subscribe to my channel if you want to learn more about mental health. Some clinicians, some mental health professionals, some scientists will argue that diagnoses are actually not that important. The scientist in me just can't agree with that. And the reason is, if you incorrectly diagnose somebody with a mental health disorder, typically what follows after is some form of mental health treatment that doesn't actually fit the diagnosis that you actually have. And where that becomes a problem is you end up going to treatment. Maybe you go to therapy, and guess what? The therapy that you're getting is not working. Well, possibly the reason for that is you didn't receive the proper diagnosis, because that's how we study things. We study a diagnosis, and then we study multiple treatments to see what helps. I did a whole video on that about what a mental health diagnosis is and why we use them. And I'll go ahead and link that down in the description. And that being said, let's go ahead and jump into the symptom criteria of adjustment disorder. Adjustment disorder is defined as emotional or behavioral responses to an identifiable stressful event that's occurred in the last 3 months. What does that mean, you ask? something happened that was stressful in the past 3 months, and you've been stressed out ever since. In addition to that, the stress must be out of proportion to what will be expected from a person that's gone through a similar stressful event. And or the symptoms are clinically significant. What does clinically significant mean? Basically, it means that it's stressing you out to a high level, or it's impairing your functioning in some way. There are three additional criteria that need to be met for adjustment disorder. And the first one is a biggie. The symptoms need to be related to the stressor. The second criteria is the symptoms can't be related to normal bereavement or grieving a loss. Last required criteria or criterion is if the stressor is removed or you start to adjust or cope with the stressor, the symptoms go away or significantly decrease after 6 months. Pretty simple, right? Meeting criteria for adjustment disorder is not terribly difficult for most people that sit in my office. However, that does not mean that adjustment disorder is somehow a lesser disorder. Adjustment disorder can be very difficult for a lot of people because it's really in the name of the disorder. You're having a hard time adjusting to a stressor. That's tough. And whether that's a divorce or whether it's your kids going off to school, maybe it's deploying for yet another time. Maybe it's getting back from deployment. Maybe it's adjusting to getting out of the military. That's a tough one. So adjustment disorder is very difficult for most people. It's in the name. Adjustment disorder. That means essentially that it sucks. So don't think that adjustment disorder is somehow a lesser disorder. However, if you feel like adjustment disorder does not totally fit the picture, if there's some things that are left out, other symptoms, I encourage you to talk to your clinician about that. Because it may mean that adjustment disorder isn't quite the right fit. Maybe another disorder is, such as PTSD. But that's in another video. As always, if this video was helpful for you, please like it. Subscribe to my channel if you want to learn more about PTSD and mental health. But more important than that, if this video was helpful for you, that means it can probably be helpful for another veteran. So I ask that you share it with them. Because at the end of the day, that's really what all this is about. One veteran trying to help another.